Good evening and welcome once again. Today is our 2156th day of continuous webinar. Today's our guest is Dr. MRUGANK N. MEGHANI. He is MD in Homeopathy, M.Phil and PhD, a professor and HOD in the Department of Physiology and Biochemistry in Kamdar Homeopathic Medical College and Chief Physician in MEGHANI Homeopathic Center and 25 years of experience. Dr. Meghani, you are most welcome. Please, you can
Good
start.
evening. Thank you very much. Am I audible, ma'am, clearly?
Yes, audible.
Yes. Is my presentation visible to all, ma'am?
Yes, visible.
Okay.
Sir, it is visible, sir.
Okay, thank you. So, as you can see on the slide, my today's topic is somewhat related to my expertise in teaching, that is covering physiology. Then we will try to understand somewhat pathology, and then we will try to learn a few homeopathic therapeutics also. And the reason why choosing liver is because a small line that I have written already in the presentation, that it is one of the most overworked organ in our body, but rarely appreciated. That it has been working before our birth, that we are in our mother's womb, and the liver has been working silently, and we do not care about liver unless and until it start causing disturbances either in our digestion, or it starts appearing with some disturbances in our ultrasonography. So the topic for today is from hepatocyte to healing and integrating liver physiology with homeopathic therapeutics. Why we are considering liver as one of the most important and vital organs? Because it performs more than 500 vital functions every single day, and it complains only when almost 75 to 80% of liver has been damaged. And that's why it is also called as one of the most silent organ of our body. Let's move further. Here I have tried to show a brief anatomy, that it is one of the largest solid organ of our body, and it has multiple functions. Digestion and metabolism are only few of the many. It is situated in right upper quadrant, just below diaphragm, protected by our rib cage. It is weighing between 1 to 1.5 kg, reddish brown in color, firm in consistency, yet friable, that when it is being pressed, it will break broken down. It is wedge-shaped organ, and it has a particular capsule which is protecting it, that is called as glycan capsule. Now, if you remember in previous slide, I was saying that it is very silent organ because it doesn't feel pain. It will become painful only if this glycan capsule will get involved. So glycan capsule is the part of the liver which is sensitive to pain. Now, if we go deeper to understand how the liver is functioning very well, then we can understand it by this diagram. It is covering both the things, that is our microscopic anatomy and microscopic physiology. So as you can see in this diagram, it is particularly showing this hepatocyte and along with sinusoids. So what liver is actually made up of? It is made up of 8 coinode segments which are functionally independent, and that is one of the miracle of our mother nature by generating such anatomy and such structural integrity, that though they are part of a single organ, they are functionally independent. And because of that only, if one part of liver is damaged, the remaining part of liver remains functional and it keeps on performing its function at its best. So it is made up of 8 coinode segments which are functionally independent. And if we see microscopically, then it has hexagonal pyramidal hepatic lobules inside the liver. And the key cells of the livers are hepatocytes, Kupffer cells, stellate cells, and cholangiocytes. Now, if we see the diagram, then you can see that on the every side of this hepatic lobule, they are covered by three major things, which is called as portal triad. Portal triad has one portal vein, one hepatic artery, so branches of portal vein, branches of portal artery, and there is a bile duct. These three jointly called as portal triad. So another thing that we might be already knowing, that liver is one of the such organ that it receives a large quantity of blood supply. Okay, and it is also receiving a dual blood supply through portal vein and hepatic artery. So portal vein is draining the blood from lower abdomen, that is the blood which is coming from our intestine. So whenever we ingest food, we eat, and then the food is getting reabsorbed from intestine to the bloodstream. Then it is taken up by portal vein, and before moving further, this portal vein will drain inside the liver. So the blood which is coming from portal vein is nutrient rich. Then second vessel is hepatic artery, which is bringing oxygenated blood. So the blood that is rich with oxygen. So in different language, we can say that hepatic artery is coming for liver's own need, and the blood which is bring by portal vein is for the bodily need. Then these both bloods, nutrient rich and oxygen rich blood, gets mixed in sinusoids, and there it is getting processed by hepatocytes, where they are performing multiple functions, which we are going to see in further slides. And finally, the blood which is being filtered by liver is going to exit via hepatic veins. So these are the few of the many functions that the liver is performing, and because of the number of functions and complexity of the functions, it can also be said as a factory. Okay, because more than 500 functions are getting performed at a time inside the liver. So major functions that the liver is performing is metabolism, detoxification, storage of multiple substances. It is responsible for providing immunity, and it has also got some hormonal control. So if we talk about metabolism, it controls metabolism of all carbohydrates, proteins, and lipids. It detoxifies drugs, alcohol, hormones, and environmental toxins which are being passed through liver. It can store iron, copper, vitamins like A, D, B12, and glycogen. These Kupffer cells, which are otherwise called as fixed macrophages, they can remove bacteria, dead cells, and endotoxins within the liver itself. And hormones like thyroid hormones, insulin, estrogen, other antibodies, they are also getting destroyed or filtered by liver. So first, if we see what exactly liver does in case of metabolism, so starting with the first part, that is carbohydrate metabolism, it maintains blood glucose level minute by minute. Like any change in our blood glucose level is constantly being supervised by our liver. And as you can see in the slide, that they have put all three major metabolic pathways for carbohydrate metabolism, that is glycogenesis, that is conversion of glucose into glycogen, then glycogenolysis, that is breakdown of glycogen into glucose, and gluconeogenesis, that is formation of glucose from other sources just like protein or fats. So all major carbohydrate metabolic pathways are under control of liver and the enzymes that are being formed by liver. Then comes protein metabolism. So it synthesizes albumin, other clotting factors, complement proteins, and it also runs the urea cycle. So you can see that formation and breakdown of proteins are under control of liver, and it forms the plasma proteins. then it forms the clotting factors. So anyone who is having any liver disorder are supposed to have bleeding disorders earlier or later. Then complement proteins, and even it runs urea cycle. So apart from kidneys, liver is also responsible for positive nitrogen balance. Then fat metabolism, it manages the cholesterol synthesis, triglycerides, lipoproteins, and ketone body production. So any sort of dyslipidemias, which is very common nowadays due to urban lifestyle, that itself indicates that there is derangement in health of liver. Key insight about this is without the liver, blood glucose would become dangerously unstable within hours. So anyone who is having poor control over blood glucose, they have to check their liver without fail. Now for detoxification, the words being used are the first pass effect. Anything that we have consumed that has reached to our large and small intestine and getting absorbed into blood, that has to first being passed through liver. If liver lets it pass, then only it can reach to cells of the body. So the first pass effect is everything which is absorbed from intestine has to reach and clear the liver pathway. It neutralizes alcohol, certain toxic medicines, food preservatives, artificial colors, hormones, ammonia, and environmental pollutants before they reach to systemic circulation. So you can see that liver is protecting us without our knowledge. And how efficient liver is, that you can see that the liver converts toxic ammonia into harmless urea approximately 20,000 times every minute. So the molecules of urea, 20,000 molecules of urea are ammonia are getting converted into urea every minute by liver. And if this particular function of liver fails, that the liver cannot detoxify the food that we have consumed, then it may lead to hepatic encephalopathy because of toxic buildup inside the blood itself. So the blood start to have larger amount of toxins circulating inside the whole body, and when it breaches the blood-brain barrier, it will start the brain's functionality and patient will start having encephalopathy, but liver is the culprit. Then the role of liver in immune mechanism, as it has said that it contains almost 80% of the body's fixed macrophages, which are known as Kupffer cells in case of liver. And what exactly these Kupffer cells do? They provide us defense against bacteria and parasites that is coming from the blood, which is coming from the small and large intestine, and it prevents them to enter into systemic circulation. Then it also does the clearance of RBCs, just like the spleen, that it removes damaged and aged, or we can say senile RBCs from circulation. It also filters the toxins which are coming from the food, and there may be endotoxins also. Last but not the least, that is, it is keeping continuous surveillance. And while we are saying continuous surveillance, that means your liver is receiving approximately 1.5 liters of blood every minute, which is passing through liver, and the approximate blood volume of an adult is 4.5 to 5.5 liters. So within 4 minutes, the whole blood which is present in individual's body has to pass through liver, and liver will try to control any type of antigens that can enter into our blood. Now, another feature that liver is having is regeneration. Any other part of our body is not showing this much strong possibility of regeneration than liver. That's why the words being used is the only organ that truly regenerates. That even if someone has donated and they have left only 30 to 40% of liver only in their body, which can regenerate to almost normal size within weeks, and by which phenomena they can develop. So the steps are, at first, existing hepatocytes will enlarge, which we call as hypertrophy of the hepatocytes, but it is physiological hypertrophy. Then they will start dividing, which we can call hyperplasia, but once again, it is physiological hyperplasia. And finally, they will restore original architecture also. That the growth is not only happening, but architecture and structural integrity will also restore. And clinically important part is that a living donor liver transplantation is possible only because of this remarkable regenerative capacity of liver. So liver can be transplanted or donated very easily if the other features are matching with the patient. Then certain other striking facts which we can remember about liver, that it produces approximately 800 to 1000 ml of bile every single day, which is very essential and needful for digestion of fat. Then liver stores approximately vitamin B12 for 2 to 5 years. If we are consuming sufficient vitamin B12, then it will store enough vitamins, which is enough for 2 to 5 years. And that's why the deficiency takes years to appear. Then it is a factory for plasma protein production, and that includes albumin and clotting factors. In fetal life, liver is the primary site of blood cell production before the bone marrow takes over the processes of erythropoiesis and leukopoiesis and all. Another thing, that is cholesterol homeostasis. Homeostasis is, as we know, it is maintenance of internal environment, which is very essential for smooth functioning of our body. So liver plays a major role in cholesterol homeostasis, that it produces, recycles and excretes cholesterol by different modes, and the liver by production of bile and bile salts helps in manage this cholesterol homeostasis. Then iron regulation. It produces hepcidin, which is a master hormone for iron metabolism, that whenever the erythropoiesis is happening and breakdown of RBC is happening, liver is keeping a constant eye over it, and any extra iron will be taken up by liver. The ultimate multitasker is called to the liver because it is the only organ that's simultaneously acting as endocrine, exocrine, immune, metabolic, and detoxicating organ. Now, as the image is indicating, that by performing all these functions throughout life, it may also deteriorate. And this image is particularly showing how the deterioration can be. So liver diseases often remain silent until more than 70 to 80% of functional capacity is lost. So making early recognition of any disturbances in liver's health is very essential. So how can we identify that liver's health is deteriorating even before going to laboratory diagnosis? First is reduction or decrease in metabolism and detoxification. Okay, so individual will start feeling digestive disturbances and certain symptoms which are related to accumulation of toxins in our body, just like lethargy, tiredness, lowered immunity, that patient catches very common infections very easily. So though it appears a total different picture, but it may be because of reduced functionality of liver also. Then another is reduced protein synthesis, that if you check patient's protein or serum protein analysis, then we will find out there is hypoalbuminemia, which is being synthesized in liver, and patient may also be suffering from bleeding disorders or coagulopathies. Then reduced bile formation and flow, that may be because of cholestasis, and it will appear in the form of jaundice also. Reduced immune and progressive inflammation to liver will progress into fibrosis, cirrhosis, and finally it may end up into liver failure also. So we are going through now pathological conditions one by one, and we will see that as we are progressing, the health of liver is deteriorating, and individual's life and functionality is also deteriorating with the health of liver is reduced. So first and foremost is metabolic dysfunction associated with steatotic liver disease, or you can say MASLD, and in simple terms it is known as fatty liver. So it is a very simple classification that how the grading of fatty liver is being done. So first, accumulation of fat in less than 5% of hepatocyte is normal. Above 5% of hepatocyte without significant alcohol intake will be initiation of a fatty liver condition. Okay, so from 5% to 33% is mild fatty liver, or you can say grade 1 fatty liver. From 34 to 66%, that is two-thirds of the liver or two-thirds of the hepatocytes are getting loaded with fat, that would be considered as moderate or grade 2 fatty liver, and above 67% of hepatocytes loaded with fats will be considered as severe or grade 3 fatty liver. Now this fatty liver condition is strongly linked. The most striking thing is this particular condition is often asymptomatic, that patients are coming with no symptoms but vague symptoms like fatigue, right upper quadrant of abdomen is showing heaviness, mild discomfort in abdomen, and patient will say that I am not having proper energy to perform my daily routines. So these are, as we can, but if we go for patient's examination, then it may end up into identifying the underlying liver condition, which can be hepatomegaly, central obesity, then acanthosis nigricans, that is a patchy discoloration of skin or pigmentation of skin, and it is also linked with insulin resistance. So any patient which comes up with central obesity and acanthosis nigricans, then you have to check them for blood sugar and their insulin levels also. For lab diagnosis, we can check their SGPT SGOT ratio, or you can say ALT AST as per new guidelines. Then if we send patient for ultrasound, it will show bright liver. Further, modern investigation is fibroscan, in which the scarring of the liver can be identified or rigidity of liver is being identified, in which they are seeing for fibrotic tissues that has developed inside the liver after inflammation. Then MRI PDFF, that is proton density fibrosis, which can be also identified with MRI, and if needed, patient has to go for biopsy also to identify the underlying cause. Now, here the clinical pearl is normal liver enzymes, that we go for SGPT, SGOT. If we find that it is normal in your patient, it doesn't mean that patient do not have any fatty liver disease. So this is one of the most important clinical pearl, that normal liver profile may not indicate lower normal liver health. Then this is the common, that is acute viral hepatitis, which indicates acute hepatocellular inflammation caused by hepatotropic viruses, and they may present with systemic and hepatic symptoms. The symptoms may be fever, malaise, nausea, anorexia, darkness of urine with jaundice, and right upper quadrant pain in abdomen. Signs are jaundice, hepatomegaly with tenderness, and fever. What would be the diagnostic features? Increased bilirubin level, and ALT-AST ratio is often more than 1000 international unit per liter. We have to go for viral serology, which has been shown on your screen. And simultaneously, we have to check ultrasound to exclude any biliary obstruction is there or not. In these particular conditions, clinical note is markedly elevated aminotransferases, that is ALT and AST, strongly suggest acute hepatocellular injuries. So that even without ultrasonography, if we check these liver markers clearly, we can identify earlier the liver pathology that is developing. Next is liver cirrhosis, which is end stage fibrosis with architectural distortion and portal hypertension. Here the words are very important, that this is the end stage condition for liver. Why we are saying end stage? Because it shows architectural distortion that we had seen previously, that liver is a organ which has a specific architecture and structure that even its different lobes can perform functions independently. But when the person's liver starts to go in cirrhosis, it starts disturbing the architecture of liver, and which leads into finally failure of the liver to perform its function. So here in the liver cirrhosis, symptoms can be fatigue, weakness, weight loss, distension of abdomen, that is mostly because of ascites, and leg swelling, confusion, and GI bleeding. Confusion is once again because of the increased toxic load in blood, which may cross the blood-brain barrier, and patient will start having distortion in thoughts. GI bleeding is mostly because of portal hypertension and development of varices. Signs are ascites, splenomegaly, spider nevi, and caput medusa. Once again, they are because of portal hypertension. Palmar erythema, muscle wasting because proteins are getting broken down, and asterixis. Diagnostic features are reduced albumin level, increased bilirubin level, and decreased platelet levels. These are the strong features of cirrhosis of liver. You can send the patient for ultrasound and fibroscan for identifying the scarring of the liver. Patient also can be sent for endoscopy for identifying the varices. And these are the high-end scores, that is Child-Pugh and MELD scores, that is model for end-stage liver disease, which are helpful for prognostic feature or telling the patient what would be the outcome of this particular condition. Now, once again, clinical note for this condition is low platelet count. Many a times patients are coming to us with no other features, but low platelet count is one of the earliest laboratory clue for portal hypertension. So patient may not be having anything like jaundice or splenomegaly, but if the patient is having low platelet count, then you have to check the patient for portal hypertension. So once again, these are indicating the flow chart to identify the health of the liver. So gross or naked eye appearance of all four condition. In case of normal liver or healthy liver, it is smooth in texture and it gives normal function, that liver markers of all they would be normal. In case of fatty liver, or it is also called as steatotic liver, it shows fat accumulation in liver cells and it may be linked with diet, obesity, diabetes, or alcoholism. In case of fibrotic changes, it is happening mostly because of persistent inflammation, which leads to formation of scar tissue. And once again, whenever there is changes of fibrosis, it always comes in the form of reduction in functional tissue. So it reduces the liver efficiency. And finally, that is cirrhosis, that involves permanent irreversible tissue damage. So second and third are somewhat reversible and treatable, that is fatty liver and fibrosis. If it is not progressing, But once the patient enters into cirrhotic liver changes, we can also only help them. We cannot bring the normal health of the damaged liver. Now, another clinical point of view that we can see in this slide is, though we are talking about liver, the color of the urine also shows the health of the liver. So as your urine turns from pale light to yellow and from yellow to orange and from orange to dark brown and reddish, they are showing the deterioration of the health of the liver. So if individual is having enough hydration only, that is also very much essential for maintaining a good liver health. So if the urine is getting darker of patient, you have to ask the patient to check their liver profile and have more hydration or maintain hydration regularly. So dark brown or reddish urine may signal serious dysfunction of liver or very high levels of bilirubin and biliverdin. Another condition is hepatocellular carcinoma, which is otherwise called as primary liver cancer, and it doesn't develop directly. But if we see on allied side, then it has always asked for background of either cirrhosis or chronic hepatitis B. So when a patient has suffered from any of these conditions, then they are very much prone to develop or convert into hepatocellular carcinoma. Symptoms for it is weight loss, persistent abdominal pain, anorexia, fever, and early satiety, that few mouth fills up the throat. Signs are hard, irregular liver, which can be felt from outside itself by palpitations. Then ascites, cachexia, and there are signs of jaundice. Diagnostically, very much important marker is AFP, that is alpha fetoprotein, that may be elevated. Triple phase CT, dynamic MRI, and ultrasound surveillance at every 6 months are needed to those patients who have suffered from either cirrhosis or chronic hepatitis, to keep on checking that it is not getting converted into hepatocellular carcinoma. Clinical note for this particular condition is a normal alpha fetoprotein cannot rule out hepatocellular carcinoma, though it is considered as one of the marker, but even the normal levels of AFP cannot suggest that liver is functioning normally. Then another variant is there, that is autoimmune hepatitis, which is the injury to liver because of immune mediated conditions. Okay, but predominantly it is affecting liver, and the symptoms are fatigue, joint pain, amenorrhea, jaundice, and pruritus. Pruritus is mostly because of accumulation of ammonia and nitrogenous products in blood. Signs can be hepatomegaly, spider angiomas, and features of other autoimmune disease which may be running in background. So once again, the patients which are coming coming for any of the vascular disorders, just like spider angiomas, one has to check for liver functionality or health of the liver. For diagnosis, we can go for anti-nuclear antibodies, ASMA positivity. Then if the immunoglobulins are elevated, if it is allergic, then IgG may be, or IgE even may be positive or higher side. Liver biopsy confirms the interface of hepatitis which patient may be suffering from. And here they are saying the clinical note is any young female who is having higher levels of liver enzymes, AST and ALT, one has to, or physician has to always suspect the patient may be suffering from autoimmune hepatitis. Another striking case which can disturb the liver, that patient is having Wilson's disease. Okay, so Wilson disease, though it is because of copper overload, but it takes toll on liver because liver constantly keeps on filtering the extra copper that patient is consuming through diet. So autosomal recessive disorder causing copper accumulation in liver, brain, and cornea. So the image is indicating the particular Kaiser-Fleischer rings in the cornea. patient may be having dystonia and hepatomegaly. Other symptoms are hepatitis, tremors, psychiatric symptoms, difficulty in speech, and movement disorders. You can see, apart from hepatitis, none other symptoms has nothing to do with liver, but it is because of liver. You can check for serum ceruloplasmin levels, which are lower. Then 24-hour urinary copper levels are higher, liver copper content is higher. And when any ophthalmic examination is done with slit lamp examination, it will show the positive Kesher-Fasher rings, and we can see that eyes are loaded with copper, or cornea is loaded with copper. Then comes hemochromatosis, that is just like copper, now comes the iron. So iron overload disorder causes progressive liver injury, and it can also cause multi-organ damages. The symptoms can be very common, that can be fatigue, joint pain, even diabetes, and loss of libido. So you can see over here that many a times patients keeps on taking medicines without proper observation from physicians, and that may end up into very severe liver disorder. Signs can be bronze skin pigmentation, hepatomegaly, and patient may also develop cardiomyopathy. For diagnosis, one has to go for checking their ferritin level, which can be higher, and transferritin saturation can be more than 45%. One has to go for even genetic testing if they are not on higher side of iron intake, and they can check their liver, and for MRI, and biopsy can also be done to check the iron content. Now, clinical note for this case is, think of hemochromatosis in patients with the triad of liver disease, diabetes, and skin pigmentation. So if any patient who is having diabetes, they are complaining about pigmentation of skin, then without fail check the health of the liver. It may come out as patient is suffering from hemochromatosis. Another one which is very important for all of us homeopaths, that is iatrogenic injury to liver, or drug induced liver injury, that is being caused by prescription drugs, herbal products, or supplements. Now this is the very alarming thing which is happening nowadays in society, that patients are, or persons of society are just running through social media and finding out this product is good, this herbal product is good, this supplement is good, and they keep on taking on their own. So if patient is consuming these for a longer time without any proper physical observation by physician, then they may have this kind of iatrogenic injury to liver, which shows itself in the form of nausea, fatigue, jaundice, pruritus, and abdominal pain. You can see once again, these are the vague symptoms, but it will start coming out in the form of jaundice, and then physician may be able to know that it has bring out injury to liver. Signs can be hepatomegaly, jaundice, and rash, which is also not present every time. For diagnosis, just what we all homeopaths do, detailed drug history need to be taken. That many a times patients keep on saying everything else, but they forget that they are taking certain things, just like certain herbal products, Ayurvedic products, or synthetic supplements, which can damage their liver. A thorough medical history can often rule out any particular cause that is damaging the liver. Now, acute liver failure, or it is the alarming sign or medical emergency, which indicates rapid loss of hepatic function with coagulopathy and encephalopathy in a patient without pre-existing cirrhosis. So, as we had seen all the previous conditions, they may be chronic in nature, but this one is acute and it develops very rapidly and ends up with coagulopathy and encephalopathy, with patient who have no previous history of cirrhosis or any particular liver conditions. Symptoms are severe jaundice, confusion, which is once again because of accumulation of toxins, vomiting, drowsiness, bleeding. Signs are hepatic encephalopathy, fetor hepaticus, and cerebral edema in advanced cases of acute liver failure. They have higher levels of AST, ALT, bilirubin, ammonia. Then viral markers and toxic markers are also need to be checked, and patient has to check for condition of brain if blood-brain barrier has been breached already by toxins. Clinically, acute liver failure mostly requires immediate transplant. So timely interventions are suggested for physicians also and patients also. Now comes the second part, which is important for us, that is homeopathy. So mostly we homeopaths, we know very well that we have to stitch a personalized treatment for every patient that comes up, and liver is very vital organ, so it cannot be neglected, its health. So from pathology to personalized healing, so homeopathy is based on individualist and holistic approach where we identify the patient's whole picture and prescribe the medicine accordingly. But here we have tried to enlist few medicines which are having strong affinity to act on liver. But once again, I will repeat myself, we have to treat the patient, not only the liver. So the medicines which are present on our screen, they are very known medicines for health of the liver. That is chelidonium, which is very classic remedy or go-to remedy for any kind of liver conditions or jaundice and gallstones. Cardus marianus, which is helpful in cases of liver enlargement, fatty liver, toxic hepatitis, and alcoholic liver diseases with portal congestion. Lycopodium and Nux vomica, they are very great our polycrest remedies, which are we are using very commonly for any kind of digestive troubles. But because they are very good in digestive troubles, as they are working very nice on liver. So lycopodium is for fatty liver with bloating, flatulence, and right-sided complaints with chronic hepatitis. Nux vomica can be given in case of congested liver from alcohol, overeating, sedentary lifestyle, drugs, acidity, and constipation. Cinchona, that is once again a very good medicine for liver weakness after loss of blood or chronic illnesses. Bryonia for hepatitis and stitching pain in abdomen. Merxol is a medicine for hepatitis with jaundice, tender and enlarged liver with patients who are showing excessive salivation and offensive perspiration. Phosphorus, we know, a bleeding disorder remedy. So we can now, with the knowledge that we have seen previously today only, that any disturbances in liver can lead to coagulopathy and patient may suffer from bleeding disorders. So fatty degeneration, hepatitis, cirrhotic tendency, and hemorrhagic liver disorders, one has to think about phosphorus. Then comes sulfur. So sulfur is for sluggish liver and the patients who are showing recurrent skin complaints which are associated with liver dysfunction. Arsenic alb, once again, it is a polycrest remedy for advanced liver diseases with burning pains, ascites, restlessness, and weakness. Heparsulf for liver abscess, suppurative hepatitis, painful enlarged liver which is sensitive to touch. Podophyllum for portal congestion and other digestive troubles. Leptandra for bilious disorders. Black tarry stool, once again, they are indicating that broken down blood or iron is passing through stool. Jaundice and liver soreness. Myrica for marked jaundice with dull liver pain in right upper quadrant of abdomen. The patient is particularly showing offensive breath and clay colored stool, that is showing steatorrhea, that patient is passing fats from stool. Then chionanthus, which is a medicine or very good medicine for gallstone colic, hepatomegaly, jaundice, and frontal headache, is a very striking feature. Berberis vulgaris, once again, just like Chalidonium, it is for gallbladder disorder, biliary colic radiating to back and scapula, and any kind of hepatic discomfort. Ceonanthus, that is along with hepatomegaly and portal hypertension, it is also clearing the conditions of splenomegaly. Iris versicolor is for liver dysfunction associated with migraine, acidity, and burning gastric symptoms. Faltowry, which is one of our sarcode, it is helpful in cases of digestive disturbances from deficient bile secretion from liver. Taraxacum is for bitter taste, spotted map tongue, and chronic liver insufficiency and indigestion. Here the chart is there for the majorly used liver remedies in our homeopathy. And you can see that I have tried to show you the key indications, liver symptoms, general symptoms, which I am not going to describe all of them right now because we have to see it in patient and just check in the remedy and you can go for the remedy for the patient. Apart from medicines, what we can do for liver, that a small change or small change in your choice today can give you stronger liver tomorrow. So what we can avoid to maintain health of the liver, that is alcohol. Though we say a limited alcohol consumption is good, but if we can live without alcohol, why one should take alcohol at all? So avoid alcohol at all. Then fatty food and fried foods, they are going to bring load over the functionality of liver. So limit deep fried food, fast foods, and high fat meals. Excess of sugars and sweets, reduce intake of sweets and sugary drinks and desserts, which is a common lifestyle in today's era, so it should be avoided. Then excess of salt will lead to water retention or fluid retention in our body, and that will bring on the burden over liver. Smoking must be avoided, whether it is primary smoking or secondary smoking. So if we are not smoking, but our friends are smoking, then it is also bringing the damage to our liver. Unnecessary medications, here they have written very positively that non-prescribed drugs and supplements, if your physician is not indicating you, one must not take any such things. What can be eat to maintain the healthy liver? Then there comes green leafy vegetables like spinach, kale, methi, which are very rich in chlorophyll and it helps in detoxifying the liver. Then cruciferous vegetables like broccoli, cauliflower, cabbage, they also help in detoxifying the liver. Fruits like berries, apple, papaya, grapes, they are rich with antioxidants and fibers. Whole grains, oats, brown rice, quinoa, they improve digestion and health of the liver. One must take nuts and seeds like walnuts, almonds, flax seeds, which are loaded with good fats and that reduces inflammation also. And water, which is the most important part of our daily diet, that one must consume approximately 3 to 4 liters of fluids in a day. That helps flushing of the toxins, whether it is through liver or whether it is through kidney. There are other additional lifestyle tips also for maintaining a healthy liver, that one must have a body weight according to their BMI only. One has to manage stress with yoga and meditation. One has to go for regular exercise. Even a good walk is essential. A good sleep with 7 to 8 hours and natural detoxifying, as we have seen in this slide, that what can be eaten. And finally, regular health checkups, that we have seen in previous slides, that many a times even normal liver markers may there, but liver is suffering from inside. Okay, so this is all from my side about liver. I would like to end up my presentation by saying thank you to IFPH, Dhanesh sir, and all the team who is working tirelessly in upliftment of homeopathy. And for today's topic, I would like to say that the liver works silently every day for us. And let's all ensure that we do same for it. A healthy liver will give us a longer life and healthy life. Thank you, all of you, for listening me patiently and trying. Let me put my view on the health of the liver. Thank you, ma'am.
Thank you, Dr. Mrugank. It was a wonderful presentation. You presented well from the anatomy to the case presentation. Really wonderful presentation.
Thank you,
And any participants have any questions, means you can ask the question to Dr. Mrugank. You can close the screen sharing, Doctor.
okay, sir, ma'am. Thank you.
If anyone have any questions, means you can ask to Doctor. Or Doctor. You can unmute yourself, Doctor. Okay.
I am audible.
Yes, audible, sir.
So, Dr. Mrugank, you have presented in a nice manner with clear concept, and really the presentation is admirable. So, one thing I want to know from you, because you are running purely classical homeopathy since a long time. So,
Yes.
my question that in different stages of liver diseases, can you correlate with our miasm?
Yes, sir. At first, I would like to tell all of the participants and IFPH, sir is my principal. I have studied under the sir, and sir has taught us organon in my UG also, and even I have worked under sir as a assistant professor. So thank you very much, sir, for your kind guidance, and you have taken care of us every time. So, sir's question is very genuine that all the liver injuries are solely based upon the miasmatic presentation. So, if a patient is showing jaundice only, we can think about SORA. And if the jaundice is along with the changes of fibrosis and a part of cirrhosis is also developed, then we have to think about it has developed into psychosis, and conversion of cirrhosis into hepatocellular carcinoma, sir, that is a full-blown picture of syphilis, that now we have reached to irreversible conditions, that is a syphilitic form of homeopathic concept, sir.
So your presentation will be not complete if you will not give example from your day-to-day practice
Yes, sir.
in single. That may be acute, that may be chronic.
Yes,
So
sir.
you got success and in which manner?
Yes, sir. Commonly, I have seen multiple number of patients and I have treated them very well with jaundice particularly. In case of cirrhosis, patients are being treated, but it takes a longer time, and patients are on multiple medications along with. So if we say that they have been treated only with homeopathy, that would not be right from our side also. But those patients who are coming with higher liver profiles and jaundice, they are very nicely treated with homeopathy. And I can say within a week, they are showing prominent results. And even the gastro surgeons and physicians are also surprised that these are the results of homeopathy, sir.
Thank you very much for your nice explanation. Best of luck.
Thank you, sir. Thank you very much.
Thank you, Dr. Bindu Prasad Panda, and thank you, Dr. Mrugank. Dr. Ram Parvesha, sir, only we have 1 minute. So please say vote of thanks to Dr. Mrugank.
Thank you, Dr. Anjani.
Thank you, sir.
And everyone, namaskar and congratulations, Dr. Meghani sir. Very
Yes,
nice,
sir.
excellent session, classical
Thank you,
and
sir.
therapeutic, and multiple describe the liver medicine, jaundice, cirrhosis. So very, very thanks. Behalf of IFPH, whole team, very,
Yes,
very
sir.
thanks. Thank you. Excellent jaundice, खान पियन lifestyle या liver disease lifestyle is the best treatment, है ना?
Yes.
नित्य खाए ताजा फल फूल और कंदमूला,
Thank you, sir.
तन मन धन हो जाए बन जाए गुणशीला. Thank you.
Thank you,
Thank you,
Dr.
sir.
Rampatrasha, sir. Thank you, Dr. MRUGANK. Come again with another subject. It was wonderful.
Sure.
Thank you, everyone, for joining with us. And bye-bye. See you tomorrow at the same time. I'm
Thank you.
handing over the session to Dr. Manoj for moderating Malayalam session. Dr. Manoj, you're welcome. Please.
നമസ്കാരം IFPH